Hello everyone and welcome to another episode of Facebook Live. And today we are going to discuss on adaptive radiotherapy, which is a new technology. And there are only four machines in our country and one which is with us in American Oncology, sharing a in Hyderabad. And to discuss this, we have with us Senior Consultant Radiation Oncologist Dr. Prashant, American Oncology, sharing a in Hyderabad. Good evening, Doctor.
Hello, everyone.
So, sir, before we start this question, I request you to give us a glimpse about your expertise.
I'm a senior consultant radiation oncologist at American Oncology Institute. I have over 15 years of experience in this field of radiation oncology. I'm associated with the American Oncology Institute for last 3 years. So I'll be very happy to give you basics of what exactly this ethos adaptive radiotherapy is. And I'm very happy and privileged to have this new equipment, which makes huge differences in the lives of cancer patients.
So the first question would be, sir, what is the difference between conventional and ethos adaptive radiotherapy?
Before answering that question, I would like to tell you a few words about what exactly is radiotherapy. This radiotherapy is one of the main modality of cancer treatment along with surgery and chemotherapy. Back when I started my career 20 years back, we used to treat with conventional radiotherapy, where we made sure that we treat cancer, but along with that, we used to give many side effects to the patients because lack of technology during that time. We wish that we had good technology so that we could spare normal structures. Later, we got some techniques like IMRT and rapid arc, IGRT. But now, this ethos adaptive radiotherapy is something very new, where we use artificial intelligence to treat cancers with radiotherapy. So the main difference is, as name suggests, adaptive. The organs in our body, they change in shape and position every day, which is physiological. And we adapt to the change in the shape and the position of that organ so that we can target that organ only, and at the same time we spare the surrounding normal structures. So the side effects will be very minimal with adaptive radiotherapy.
So my next question would be, sir, why should a patient opt for adaptive treatment during radiotherapy?
As I told you, quality of life is very important once patient gets treated for cancer. It is very different nowadays. Earlier, patient were because lack of technologies or lack of advanced technologies, lifespan used to be very less. But now with advancement in not only radiation oncology but surgical oncology and also medical oncology like immunotherapies and molecular targeted therapies, patients are living longer and chances of cure has increased tremendously. And patients are presenting at earlier stages, so that chances of cure is very high. So once patient gets treatment, obviously it's good that patient gets cured, but at the same time, quality of life is very important. Patient should be having very minimal side effects because of radiation, which is possible with adaptive radiotherapy.
What are the different cancer types that can be treated with ethos adaptive radiotherapy?
As I told you, the organs which changes in shape and position daily. For example, in pelvic tumors like cancer of prostate, just for the sake of viewers, it's a gland which is present in all males. And cancer of prostate is very common among elderly males. And that is prostate is spread just below the urinary bladder. So the position of the prostate changes depending on the bladder filling and also large bowel filling, which present just behind the prostate. So one is cancer of prostate. The other pelvic tumor is cancer of cervix, which is very common among females in India. So the same thing, cervix and uterus, the position changes daily depending on bladder and rectal filling. So daily we do the imaging, we do the CT scan, and we make sure that the position of that particular organ, and we target that organ. Other than that, cancer of urinary bladder and cancer of rectum, that means lower part of larger intestine, it's coming to the pelvis. And when it comes to the upper GI malignancies, cancers associated with liver, pancreas, stomach, and also in thorax it's lung cancers and head and neck cancers. All these cancers can be treated with adaptive radiotherapy and they will be benefited.
Okay, my next question would be, sir, how long does treatment with radiotherapy take?
It depends on the site where we are treating. Normally, the duration of radiation will be anywhere between 5 to 8 weeks, depending on the site we are treating and the stage of the disease. Sometimes we do something called stereotactic body radiotherapy, SBRT short form. That means we deliver radiation in 3 to 5 sittings in limited number of cases. So the duration will be, in some cases, it's 3 to 5 sittings, that means almost 1 week, and sometimes in a regular modality, we do 5 to 8 weeks. Okay, coming to the per day, the duration is somewhere between 10 to 15 minutes. That's a difference between conventional and adaptive radiotherapy. In conventional radiotherapy, the process goes like this. For radiation planning, we do imaging, planning, and treatment execution. This imaging and planning in conventional radiation, we do only once, because that imaging and planning process, it takes 3 to 4 hours. That is the main difference. When it comes to adaptive radiotherapy, we do that part, imaging and planning, every day, depending on the site and shape and position of the target. So the thing which takes 3 to 4 hours in conventional, it hardly takes 3 to 4 minutes with adaptive radiotherapy. So that we can do the process every day. How can we do that? Because of artificial intelligence which comes with those adaptive radiotherapy mission. So every day it is between 10 to 15 minutes for the duration of anywhere between 5 to 8 weeks.
Next question would be, doctor, how safe is it to take treatment with radiotherapy?
It's absolutely safe, because main misconception, usually the general public, especially those who are in rural, they tell that radiation is something like current. It's nothing like that. Radiation treatment is absolutely painless. Patient cannot see it, cannot feel it, cannot smell it. It's like just undergoing a simple X-ray. Coming to the adaptive radiotherapy, it's absolutely safe, as I suggested, because the amount of normal structures which are irradiated with this particular technique is very less. The main advantage with the adaptive radiotherapy is we can deliver very high dose to the target, because patient will be having very less side effects, because the more dose we can deliver, the more chances of cure.
So the next question would be, sir, what are the side effects of adaptive radiation therapy?
The side effects of radiotherapy depends on the site where we are treating. This is a bit different from medical oncology or chemotherapy treatment. Chemotherapy treatment usually works in entire body, whereas radiation treatment is localized treatment. That means we target the area where the organ with cancer is there. So it depends on which site we are treating. Most common, when we are treating pelvic cancer, the side effects what we can expect is, because we are irradiating large bowel and urinary bladder, patient might be having difficulty in passing urine, burning micturition, loose motions, and in severe severe cases, patient might develop bleeding in the stools. The advantage with adaptive radiotherapy, these side effects are minimal. When it comes to the upper GI malignancies, if we irradiate small bowel which is around the upper GI, like liver or pancreatic cancers, patient will be having difficulty in digestion, vomitings, and pain abdomen, those things. So the main intention is to spare those normal structures. Similarly, when we are treating head and neck cancers like tongue, buccal mucosa, like cheek or neck, then we can expect something like oral mucositis and long-term side effects like xerostomia, that means dryness of mouth, which won't be there with adaptive radiotherapy, because we are sparing the salivary glands and other like constrictor muscles, which helps in swallowing, which does the swallowing function. So the side effects what we can expect are acute ones, even with ethos radiotherapy. But the difference between acute and chronic ones is acute ones are reversible. That means once we stop the radiation, within 2 to 3 weeks, all side effects will be gone. The advantage is they won't be having any chronic side effects, which are more or less permanent, which will be there with conventional but not with Ethos adaptive radiotherapy.
So coming to the next question, sir. What is the success rate of treatment with Ethos radiotherapy?
Studies have shown that with adaptive radiotherapy, the response, that means cure rates, are higher compared to conventional. The simple thing is we'll be able to deliver more dose to the target, which is not possible with conventional. Why? Because the surrounding structures won't be getting much dose. With conventional techniques, we are scared to give high doses to the target because we know that surrounding normal structures will also be radiated. But coming to the Ethos adaptive radiotherapy, we know that normal structures won't be getting that much dose, so we'll be focusing on the target, we'll deliver more dose, so that response rates compared to the conventional, it will be very higher.
Okay, my next question would be, sir, how many times can a person get radiation treatment?
It depends on, suppose, as I told you, it's a localized treatment. Sometimes if patient gets tumor recurrence or second malignancy at different site where he or she was irradiated earlier, then we can treat immediately also. Suppose if we are in a situation where we had to irradiate at the same place where patient received radiation earlier, then we need to give significant gap, like 3 to 5 years. Nowadays, because the lifespan, the cure rates are getting higher and the patients are getting recurrence also. So, if it like 3 to 5 years, depending on the site, we can re-irradiate at the same site. And the advantage with the Ethos is, again, it is very localized treatment. Even that area was irradiated earlier also, we can deliver precisely and effectively.
Okay. The next question would be, sir, what are the precautions to be taken while getting treated with Ethos radiotherapy?
Again, it depends on the site. Normally, when it comes to the pelvic malignancies, like as I told you, prostate or cervical malignancies, normal that localized skin reactions are common. The most common side effect is dryness of the skin, where we advise patient to apply mild moisturizer. And coming to, because bladder and rectal will be around the targets, we ask them to take plenty of water, to take diet which is easily digestible, to avoid hot and spicy ones. And at the same time, even upper GI malignancies also, we advise them to take easily digestible, low fatty and low oily, no fried foods, and if possible, good amount of vegetables and fruits, which is well cooked, not raw ones, when it comes to vegetables. And coming to the head and neck malignancies, we advise them to maintain good oral hygiene and maintain good diet. And at the same time, we advise them not to take this spicy and hot stuff. So it depends on the site where we are irradiating. When it comes to lung malignancies, we advise them to do some sort of exercises like breath holding technique, which they have to do to reduce the side effects. We advise them to do those exercises regularly in thorax cancers.
So my last question would be to you, sir. Does receiving Ethos adaptive radiotherapy treatment reduce the likelihood of cancer recurrence?
Definitely, the chances of the tumor response is very good compared to regular techniques. As I mentioned, we can deliver high dose. Obviously, it again depends on the site we are treating. When it comes to the cures, when we are treating very early stage cancers are stage 1, 2, 3 and 4. 3 and 4 is very late stage. 1, 2 is relatively early disease. Those patients who present with one stage, their chances of regression cure is very high. 2 is again good. 3, it's like 50 to 60%, again depending on the site where we are treating. Stage 4 is obviously it's metastatic disease, chances of cure is very less. When it comes to Ethos radiotherapy, the response rates are better obviously because we can deliver as very high doses to the target.
Thank you, doctor, for your valuable time and giving us a lot of inputs on this adaptive radiotherapy. So With this, we conclude our session on Facebook Live for today, and we'll be back with another episode. Till then, be safe and be healthy. Thank you.
Thank you.